What is COVID-19? COVID-19 is the infectious disease caused by the coronavirus, SARS-CoV-2, which is a respiratory pathogen. WHO first learned of this virus from cases in Wuhan, People's Republic of China on the 31st of December 2019. What are the symptoms of COVID-19? The most common symptoms of COVID-19 are fever, dry cough, fatigue. Other symptoms that are less common and may affect some patients include loss of taste or smell, nasal congestion, conjunctivitis, also known as red eyes, sore throat, headache, muscle or joint pain, different types of skin rash, nausea or vomiting, diarrhea, chills or dizziness. Symptoms are usually mild. Some people become infected but only have very mild symptoms or none at all. Symptoms of severe COVID-19 disease include shortness of breath, loss of appetite, confusion, persistent pain or pressure in the chest, high temperature, above 38 degrees Celsius. Other less common symptoms are irritability, confusion, reduced consciousness, sometimes associated with seizures, anxiety, depression, sleep disorders. More severe and rare neurological complications such as strokes, brain inflammation, delirium and nerve damage. People of all ages who experience fever and/or cough associated with difficulty breathing or shortness of breath, chest pain or pressure, or loss of speech or movement should seek medical care immediately. If possible, call your health care provider, hotline or health facility first so you can be directed to the right clinic. What happens to people who get seriously ill? Most people, about 80%, recover from the disease without needing hospital treatment. About 20% of those who get COVID-19 become seriously ill and require oxygen, with 5% becoming critically ill and needing intensive care. Complications leading to death may include respiratory failure, acute respiratory distress syndrome, ARDS, sepsis and septic shock, thromboembolism, and/or multi-organ failure, including injury of the heart, liver, or kidneys. In rare situations, children can develop a severe inflammatory syndrome a few weeks after infection. Who is most at risk of severe illness from COVID-19? People age 60 and over, and those with underlying medical problems like high blood pressure, heart and lung problems, diabetes, obesity, or cancer are at higher risk of developing serious illness. However, anyone can get sick with COVID-19 and become seriously ill or die at any age. How can we protect others and ourselves if we don't know who is infected? Stay safe by taking some simple precautions, such as physical distancing, wearing a mask, keeping rooms well ventilated, avoiding crowds, cleaning your hands, and coughing into a bent elbow or tissue. Check local advice where you live and work. Do it all. When should I get a test for COVID-19? Anyone with symptoms should be tested wherever possible. People who do not have symptoms but have had close contact with someone who is or may be infected may also consider testing. Check with your local health guidelines. While a person is waiting for test results, they should remain isolated from others. Where testing capacity is limited, tests should first be done for those at higher risk of infection, such as health workers, and those at higher risk of severe illness, such as older people, especially those living in seniors' residences or long-term care facilities. What tests should I get to see if I have COVID-19? In most situations, a molecular test is used to detect SARS-CoV-2 and confirm COVID-19. Polymerase chain reaction (PCR) is the most commonly used molecular test. Samples are collected from the nose and/or throat with a swab. Molecular tests detect virus in the sample by amplifying viral genetic material to detectable levels. For this reason, a molecular test is used to confirm an active infection, usually within a few days of exposure and around the time that symptoms may begin. What about rapid tests? Rapid tests, sometimes known as a rapid diagnostic test (RDT), detect viral proteins known as antigens. Samples are collected from the nose and/or throat with a swab. These tests are cheaper than PCR and will offer results more quickly, although they are generally less accurate. We are still learning about how well they perform and when to use them. I want to find out if I had COVID-19 in the past. What tests should I take? Antibody tests can tell us whether someone has had an infection in the past, even if they have not had symptoms. Also known as serological tests and usually done on a blood sample. These tests detect antibodies produced in response to an infection. In most people, antibodies start to develop after days to weeks and can indicate if a person has had recent IgM-type antibodies or past infection IgG-type. Antibody tests cannot be used to diagnose COVID-19 in the early stages of infection or disease. They also cannot alone confirm immunity or duration of protection from reinfection. What is the difference between isolation and quarantine? Both isolation and quarantine are methods of preventing the spread of the disease. Quarantine means restricting activities and/or separating people who are not ill but may have been exposed to COVID-19. The quarantine can take place in a designated facility or at home for 14 days. Isolation means separating people who are ill with symptoms of COVID-19 and/or have tested positive. What should I do if I have been exposed to someone who has COVID-19? If you have been exposed to someone with COVID-19, you may become infected, even if you feel well. After exposure to someone who has COVID-19, do the following. Call your healthcare provider or COVID-19 hotline to find out where and when to get a test. Cooperate with contact tracing procedures to stop the spread of the virus. If testing is not available, stay home and away from others for 14 days. During this time, do not go to work, to school, or to public places. Ask someone to bring you supplies. Keep at least a 1-meter distance from others, even from your family members. Wear a medical mask to protect others, including when you need to seek medical care. Clean your hands frequently. Stay in a separate room from other family members. And if not possible, wear a medical mask. Keep the room well ventilated. If you share a room, place beds at least 1 meter apart. Monitor yourself for any symptoms for 14 days. Stay positive by keeping in touch with loved ones by phone or online, and by exercising at home. If you live in an area with malaria or dengue fever, seek medical help if you have a fever. While traveling to and from the health facility and during medical care, wear a mask. Keep at least a 1-meter distance from other people and avoid touching surfaces with your hands. This applies to adults and children. How long does it take to develop symptoms? The time from exposure to COVID-19 to the moment when symptoms begin is, on average, 5 to 6 days and can range from 1 to 14 days. This is why people who have been exposed to the virus are advised to stay home, apart from others, for 14 days in order to prevent the spread of the virus, especially where testing is not easily available. What should I do if I have COVID-19 symptoms? If you have any symptoms suggestive of COVID-19, contact your healthcare provider or COVID-19 hotline for instructions and find out when and where to get a test. Stay at home for 14 days away from others and monitor your health. If you have shortness of breath or pain or pressure in the chest, seek medical attention immediately. Call your healthcare provider or hotline in advance for direction to the right health facility. If you live in an area with malaria or dengue fever, seek medical care if you have a fever. If local guidance recommends visiting a medical center for testing, assessment, or isolation, wear a medical mask while traveling to and from the facility and during medical care. Also, keep at least a 1-meter distance from other people and avoid touching surfaces with your hands. This applies to adults and children. Is there a vaccine for COVID-19? Not yet. Many potential vaccines for COVID-19 are being studied, and several large clinical trials may report results later this year. If a vaccine is proven safe and effective, it must be approved by national regulators, manufactured and distributed. WHO is working with partners around the world to help coordinate key steps in this process. WHO is working through the ACT Accelerator to facilitate equitable access to a safe and effective vaccine for the billions of people who will need it once it is available. Are there treatments for COVID-19? Scientists around the world are working to find and develop treatments for COVID-19. Optimal supportive care includes oxygen for severely ill patients and those who are at risk for severe disease, and more advanced respiratory supports such as ventilation for patients who are critically ill. Dexamethasone is a corticosteroid that can help reduce the length of time on a ventilator and save lives of patients with severe and critical illness. Read our dexamethasone Q&A for more information. Results from the WHO's Solidarity trial indicated that remdesivir, hydroxychloroquine, lopinavir, ritonavir and interferon regimens appeared to have little or no effect on 28-day mortality or the in-hospital course of COVID-19 among hospitalized patients. Hydroxychloroquine has not been shown to offer any benefit for treatment of COVID-19. Read our hydroxychloroquine Q&A for more information. WHO does not recommend self-medication with any medicines, including antibiotics, as a prevention or cure for COVID-19. WHO is coordinating efforts to develop treatments for COVID-19 and will continue to provide new information as it becomes available. Are antibiotics effective in preventing or treating COVID-19? Antibiotics do not work against viruses, they only work on bacterial infections. COVID-19 is caused by a virus, so antibiotics do not work. Antibiotics should not be used as a means of prevention or treatment of COVID-19. In hospitals, physicians will sometimes use antibiotics to prevent or treat secondary bacterial infections, which can be a complication of COVID-19 in severely ill patients. They should only be used as directed by a physician to treat a bacterial infection.